Do you want to successfully complete the D236 objective assessment exam? Then you are in the right place. Our website provides a list of questions and answers for your success in the D236 OA exam for free. We understand that acing your OA exam can be quite challenging. That's why we provide completely free exam guides and practice questions for you. In this video, we will cover questions from genetic disorders, bone pathology, immune system, musculoskeletal injuries and joint diseases. So, let's get started. 1. A patient presents with excessive bone breakdown and elevated blood calcium levels. Which hormonal imbalance would most likely explain this clinical presentation and its underlying mechanism? A. Decreased parathyroid hormone production. B. Elevated calcitonin levels. C. Hyperparathyroidism present. D. Vitamin D deficiency. Can you guess the answer? Correct answer, C. Hyperparathyroidism present. Explanation. Option C is correct because hyperparathyroidism causes excessive parathyroid hormone release, which stimulates osteoclast to break down bone tissue, releasing calcium into the bloodstream and causing hypercalcemia. Option A is incorrect because decreased parathyroid hormone production would actually reduce osteoclast activity and lower blood calcium levels, not increase them as described. Option B is incorrect because elevated calcitonin levels would promote calcium deposition into bones and reduce blood calcium, opposing the described presentation. Option D is incorrect because vitamin D deficiency would impair calcium absorption from the intestines, typically leading to hypercalcemia rather than elevated calcium. Let's dive into the fascinating world of bone metabolism and calcium regulation. When we see a patient with excessive bone breakdown and elevated blood calcium, we need to understand the hormonal orchestra at play. The parathyroid glands produce PTH, or parathyroid hormone, which acts like a foreman directing osteoclasts, the demolition crew of bones. In hyperparathyroidism, there's too much PTH being produced, causing these osteoclasts to work overtime, breaking down bone tissue and releasing calcium into the bloodstream. This creates hypercalcemia, or high blood calcium. Now, decreased PTH would actually do the opposite. It would reduce bone breakdown. Elevated calcitonin from the thyroid would promote calcium storage in bones, lowering blood calcium. And vitamin D deficiency typically leads to low calcium because it impairs intestinal absorption. So hyperparathyroidism is our culprit here, causing this cascade of excessive bone destruction and dangerous calcium elevation. 2. During bone fracture healing, which stage involves the formation of new blood vessels and soft tissue that bridges the fracture gap before actual bone formation begins? A. Granulation tissue formation. B. Inflammatory phase only. C. Lamellar bone deposition. D. Final remodeling stage. Do you know the answer? Correct answer, A. Granulation tissue formation. Explanation. Option A is correct because granulation tissue formation is the second stage of fracture healing, where fibroblasts and new blood vessels create vascular tissue that bridges the fracture site. Option B is incorrect because the inflammatory phase involves hematoma formation and white blood cell infiltration, but not the vascular tissue bridge formation. Option C is incorrect because lamellar bone deposition occurs later when organized mineralized bone replaces the callus, not during initial tissue formation. Option D is incorrect because the remodeling stage is the final phase where bone is reshaped by mechanical stresses after healing is complete. To really understand fracture healing, let's explore the critical second stage called granulation tissue formation. After a bone breaks, the body initiates an amazing repair process that unfolds in distinct stages. The first stage is inflammation, where blood pools at the fracture site forming a hematoma, and white blood cells rush in to clean up debris. But the real bridge building happens in stage 2, granulation tissue formation. This is when fibroblasts, which are like the body's construction workers, arrive and start laying down a framework of new connective tissue. Simultaneously, new blood vessels begin sprouting into this area, creating a vascular network that will supply nutrients for healing. This soft vascular tissue literally bridges the gap between the broken bone ends. It's not yet bone, but it's the crucial scaffolding that will support actual bone formation in the later stages of callus formation and remodeling. 3. A child with hereditary retinoblastoma develops bilateral eye tumours earlier than sporadic cases. This exemplifies which genetic principle explaining how cancer develops in predisposed individuals? A. Chromosomal translocation theory. B. Mosaicism development pattern. C. Epigenetic modification process. D. Two-hit hypothesis mechanism. Can you guess the answer? Correct answer. D. Two-hit hypothesis mechanism. Explanation. Option D is correct because the two-hit hypothesis explains that hereditary cancer requires 2 mutations, one inherited and one acquired, causing earlier and bilateral tumour development. Option A is incorrect because chromosomal translocation involves chromosome segments switching places, not the sequential mutation process seen in retinoblastoma development. Option B is incorrect because mosaicism refers to cells with different chromosome numbers within one individual, not the mutation accumulation in cancer. Option C is incorrect because epigenetic modifications change gene expression without DNA sequence changes, unlike the permanent mutations in retinoblastoma. Let's explore why children with hereditary retinoblastoma develop eye tumours earlier than those with the sporadic form. This perfectly illustrates Knudsen's two-hit hypothesis, a groundbreaking concept in cancer genetics. Think of cancer development like a 2-lock safe. You need to break both locks to open it. In our genes, we have 2 copies of each tumour suppressor gene, one from each parent. These act as the locks protecting us from cancer. In hereditary retinoblastoma, children are born with one lock already broken. They inherited a mutated gene from a parent. This is their first hit. They only need one more mutation, a second hit, in any eye cell to develop cancer. That's why they get tumours earlier, and often in both eyes. In contrast, people with sporadic retinoblastoma start with both locks intact and need 2 separate mutations in the same cell, which takes much longer and usually affects only one eye. 4. Which joint type allows the most movement and contains synovial fluid, articular cartilage, and a fibrous capsule surrounding the joint space for lubrication? A. Synarthrosis joint type. B. Diarthrosis synovial joints. C. Amphiarthrosis vertebral connections. D. Fibrous skull sutures. Do you know the answer? Correct answer. B. Diarthrosis synovial joints. Explanation. Option B is correct because diarthrosis joints are synovial joints containing synovial fluid, articular cartilage, and fibrous capsules, allowing maximum movement like in shoulders and knees. Option A is incorrect because synarthrosis joints are immovable connections, like skull sutures that lack synovial fluid and allow minimal movement. Option C is incorrect because amphiarthrosis joints allow only slight movement and lack the complex synovial structure described in the question. Option D is incorrect because fibrous skull sutures are examples of synarthrosis joints that are immovable and lack synovial components entirely. Now let's examine the joint that allows you to throw a ball, dance, or simply wave hello, the synovial joint, also called diarthrosis. These are the body's most mobile joints, and they're engineering marvels. Picture a high-tech bearing system. The joint is encased in a tough fibrous capsule that holds everything together like a protective sleeve. Inside this capsule, there's a special lining called the synovial membrane that produces synovial fluid, Think of it as premium motor oil for your joints. The bone ends are covered with smooth, articular cartilage, like Teflon caps that prevent grinding. Together, these components create frictionless movement. Compare this to synarthrosis joints like skull sutures that don't move at all, or amphiarthrosis joints between vertebrae that barely wiggle. Synovial joints are the superstars of movement, found in your shoulders, knees, and hips. 5. In osteoporosis, which cellular imbalance leads to porous fragile bones, particularly affecting the hip, wrist, and vertebrae, with increased fracture risk. A. Osteoclast exceeds osteoblast activity. B. Osteoblast activity exceeds osteoclast. C. Equal bone formation resorption. D. Complete cellular activity cessation. Can you guess the answer? Correct answer. A. Osteoclast exceeds osteoblast activity. Explanation. Option A is correct because osteoporosis occurs when osteoclastic bone resorption surpasses osteoblastic bone formation, creating porous bones, especially in trabecular bone areas. Option B is incorrect because excessive osteoblast activity over osteoclasts would actually increase bone density, not cause the porosity seen in osteoporosis. Option C is incorrect because equal bone formation and resorption maintains normal bone density, not the decreased density characteristic of osteoporosis. Option D is incorrect because complete cessation of cellular activity would prevent both bone formation and resorption, not the imbalanced process in osteoporosis. Understanding osteoporosis requires us to think about bone as a constantly renovating building. In healthy bones, there's a perfect balance between the demolition crew, called osteoclasts, and the construction crew, called osteoblasts. But in osteoporosis, this balance tips dramatically. The osteoclasts go into overdrive, breaking down bone faster than the osteoblasts can rebuild it. Imagine demolishing rooms faster than you can build new ones. Eventually, your building becomes hollow and weak. This especially affects trabecular bone, the spongy inner structure found in the hip, wrist, and spine. These areas become porous, like Swiss cheese, making them incredibly fragile. A simple fall that wouldn't harm normal bones can cause devastating fractures. This isn't like other scenarios where construction exceeds demolition, which would actually strengthen bones, or where everything stops, which would freeze the bone in its current state. 6. A pregnant woman consuming alcohol exposes her fetus to teratogens. Which characteristic facial feature combination specifically indicates fetal alcohol syndrome diagnosis? A. Large palpebral fissures present. B. Prominent defined philtrum ridge. C. Smooth philtrum. Thin lips. D. Thick vermilion border visible. Do you know the answer? Correct answer, C. Smooth philtrum, thin lips. Explanation. Option C is correct because fetal alcohol syndrome presents with a smooth philtrum between nose and upper lip, plus thin vermilion border, as characteristic diagnostic facial features. Option A is incorrect because fetal alcohol syndrome causes small palpebral fissures or eye openings, not large ones as suggested here. Option B is incorrect because a prominent philtrum ridge is normal anatomy. Fetal alcohol syndrome causes a smooth, flat philtrum lacking definition. Option D is incorrect because fetal alcohol syndrome causes a thin vermilion border of the lips, not the thick border described. Let's examine the heartbreaking facial features that diagnose fetal alcohol syndrome, a completely preventable tragedy. When alcohol crosses the placenta, it acts like a sculptor's tool, but instead of creating beauty, it disrupts normal facial development. The eyes show another clue with small palpebral fissures, meaning the eye openings are narrower than normal. These aren't random changes, they're specific markers that occur when alcohol interferes with facial development during crucial weeks of pregnancy. Each feature alone might seem subtle, but together they form an unmistakable pattern that healthcare providers recognize. The most distinctive feature is the philtrum, that little groove between your nose and upper lip. In healthy development, this forms a defined ridge, but alcohol exposure smooths it completely flat, like someone erased it. The lips also tell the story. The vermilion border, which is the coloured part of your lips, becomes abnormally thin. 7. Which immune system component provides immediate, non-specific defense through physical barriers and phagocytic cells without requiring previous pathogen exposure? A. Adaptive memory cells. B. Innate immunity system. C. Antibody production only. D. T-cell specific response. Can you guess the answer? Correct answer, B. Innate immunity system. Explanation. Option B is correct because innate immunity provides immediate, non-specific defense through barriers like skin and phagocytes, functioning from birth without prior pathogen exposure. Option A is incorrect because adaptive memory cells require previous pathogen exposure to develop and provide specific, not immediate, non-specific defense. Option C is incorrect because antibody production is part of adaptive immunity, requiring time and prior exposure, not immediate, non-specific defense. Option D is incorrect because T-cell responses are part of adaptive immunity with specific pathogen recognition, not the immediate, non-specific system. Your body has two defense systems, like a castle with both walls and soldiers. The innate immune system is your body's ancient first line of defense, ready from the moment you're born. Think of it as your permanent security team that doesn't need any training or prior warning. Your skin acts like a fortress wall, physically blocking invaders. If pathogens breach this barrier, phagocytic cells like neutrophils and macrophages patrol constantly, ready to engulf any intruder they encounter. They don't need to recognize specific enemies. They attack anything foreign immediately. This is completely different from adaptive immunity, which needs time to study the enemy and create specific weapons like antibodies. Adaptive immunity involves memory cells that remember past invasions and T cells that need activation. The beauty of innate immunity is its speed. It responds in minutes to hours, not the days or weeks adaptive immunity requires. 8. During osteoarthritis development, which cells become overactive in response to mechanical stress, leading to cartilage, matrix degradation, and joint deterioration? A. Osteoclast bone cells. B. Synovial membrane cells. C. Satellite muscle cells. D. Chondrocytes in cartilage. Do you know the answer? Correct answer, D. Chondrocytes in cartilage. Explanation. Option D is correct because chondrocytes in articular cartilage become overactive under excessive mechanical stress, degrading the cartilage matrix and causing osteoarthritis progression. Option A is incorrect because osteoclasts break down bone tissue, not cartilage, and primarily affect subchondral bone in later osteoarthritis stages. Option B is incorrect because synovial membrane cells produce synovial fluid and become inflamed secondarily, not primarily driving cartilage degradation. Option C is incorrect because satellite cells are muscle stem cells involved in muscle regeneration, not cartilage degradation in joint disease. To understand osteoarthritis at the cellular level, we need to focus on the unsung heroes of your joints, the chondrocytes. These specialized cells live inside your cartilage and normally maintain its health by balancing breakdown and repair. Cartilage is like a smooth, cushiony cap on your bones that allows painless movement. But when mechanical stress becomes excessive, from obesity, injury, or repetitive use, these chondrocytes receive danger signals. They shift into overdrive, like workers panicking during an emergency. Instead of maintaining balance, they start producing enzymes that break down the cartilage matrix faster than they can repair it. This isn't osteoclast breaking down bone, or synovial cells producing fluid, or muscle satellite cells regenerating tissue. This is specifically chondrocytes destroying their own home, the cartilage matrix, leading to the painful bone-on-bone contact that characterizes osteoarthritis. 9. A complete ligament tear causing severe pain, joint instability, and inability to bear weight represents which grade of sprain injury severity? A. Grade 3 severe, B. Grade 1 mild, C. Grade 2 moderate, D. Grade 1V extreme. Can you guess the answer? Correct answer, A. Grade 3 severe. Explanation. Option A is correct because grade 3 sprains involve complete ligament tears, causing severe pain, complete loss of joint function, and inability to bear weight. Option B is incorrect because grade 1 sprains involve mild stretching with no tearing, slight swelling, and maintained joint function. Option C is incorrect because grade 2 sprains have partial tears with moderate pain and reduced but not complete loss of function. Option D is incorrect because there is no grade 1V classification in the standard sprain grading system, which uses only 3 grades. Let's explore the most severe type of ligaments injury, a grade 3 sprain. Ligaments are like tough rubber bands that hold bones together at joints, providing stability while allowing movement. In a grade 3 sprain, this rubber band doesn't just stretch or partially tear, it completely snaps in two. Imagine cutting a rope that's holding something stable. Everything becomes unstable immediately. The joint loses all structural support, causing severe immediate pain that patients often describe as excruciating. The joint becomes completely unstable, wobbling unnaturally because nothing is holding it in proper alignment. Weight bearing becomes impossible, not just painful, but physically impossible because the joint can't support any load. This is vastly different from grade 1, where there's just stretching, or grade 2 with partial tearing but maintained function. Grade 3 means complete structural failure, requiring surgical repair or extensive rehabilitation. 10. In Down syndrome caused by trisomy 21, what percentage of cases result from standard non-disjunction during meiosis versus translocation? A. 50% each, B. All translocation cases, C. 95% non-disjunction, D. 20% non-disjunction. Do you know the answer? Correct answer, C. 95% non-disjunction. Explanation. Option C is correct because 95% of Down syndrome cases result from standard trisomy through non-disjunction during meiosis, creating 3 copies of chromosome 21. Option A is incorrect because translocation accounts for only about 4% of cases, not an equal 50% distribution. Option B is incorrect because translocation Down syndrome represents a small minority of cases, not all Down syndrome occurrences. Option D is incorrect because non-disjunction causes the vast majority, not a minority 20% of Down syndrome cases. Down syndrome genetics reveals a fascinating story about how our chromosomes behave during cell division. In 95% of cases, the cause is a simple mathematical error called non-disjunction. During meiosis, when eggs or sperm are forming, chromosome pairs are supposed to separate evenly. Think of it like dealing cards. Each new cell should get exactly 1 chromosome 21. But in non-disjunction, both chromosomes stick together and go to the same cell, like dealing 2 cards to one player instead of 1 each. This creates a gamete with 2 chromosome 21s, which combines with a normal gamete to produce 3 total. That's trisomy. The remaining 5% involves translocation, where a piece of chromosome 21 attaches to another chromosome. This 95% non-disjunction rate makes it the overwhelming primary cause, not a 50-50 split or minority cause. 11. Which phase of Paget disease involves rapid, disorganized bone formation by osteoblasts resulting in structurally weak bone despite increased bone mass? A. Initial lytic phase. B. Mixed osteoclastic osteoblastic phase. C. Final sclerotic phase. D. Dormant inactive state. Can you guess the answer? Correct answer, B. Mixed osteoclastic osteoblastic phase. Explanation. Option B is correct because the mixed phase of Paget disease features rapid, disorganized osteoblast proliferation, creating haphazard collagen deposition, while osteoclastic activity continues simultaneously. Option A is incorrect because the lytic phase involves primarily osteoclast activity causing bone demineralization, not the disorganized formation described. Option C is incorrect because the sclerotic phase shows new bone, exceeding resorption with decreased osteoblastic activity, not rapid proliferation. Option D is incorrect because the dormant state occurs after the sclerotic phase, when both osteoclastic and osteoblastic activities have slowed. Paget disease of bone unfolds like a three-act play, with the mixed phase being the most chaotic act. Initially, in the lytic phase, osteoclasts aggressively destroy bone. But in the mixed phase, something bizarre happens. Both demolition and construction crews work simultaneously at maximum capacity. Imagine a construction site where workers are frantically tearing down walls while others desperately try to build new ones in the same space. The osteoblasts proliferate rapidly, but they're so rushed they lay down collagen fibers haphazardly, like throwing spaghetti instead of carefully placing bricks. This creates bone that's technically more abundant, but structurally weak, like a building made of randomly stacked materials. Meanwhile, the osteoclasts continue their destruction. This isn't the initial pure destruction phase, or the final sclerotic phase, where building dominates. This mixed phase is pure chaos, creating the characteristic mosaic pattern of Paget disease bone. 12. A muscle injury patient develops scar tissue during healing that reduces strength and interferes with function. Which cells normally differentiate into muscle fibers? A. Inflammatory white cells. B. Fibroblast connective cells. C. Endothelial vessel cells. D. Satellite stem cells. Do you know the answer? Correct answer, D. Satellite stem cells. Explanation. Option D is correct because satellite cells are muscle stem cells that differentiate into new muscle fibers during regeneration, though scar tissue may form instead. Option A is incorrect because white blood cells initiate inflammation and clear debris but don't differentiate into muscle fibers during healing. Option B is incorrect because fibroblasts produce scar tissue collagen that replaces muscle. They don't become functional muscle fibers themselves. Option C is incorrect because endothelial cells form new blood vessels during healing, but don't transform into contractile muscle tissue. When muscles heal after injury, the body calls upon special reserve troops called satellite cells. These are stem cells that normally lie dormant along muscle fibers, like sleeping soldiers waiting for the alarm. When muscle injury occurs, these satellite cells wake up and spring into action. They're the only cells in your body that can differentiate into new, functional muscle fibers. Think of them as muscle seeds that can grow into full muscle tissue. However, healing doesn't always go perfectly. Sometimes, instead of satellite cells creating new muscle, fibroblasts rush in and produce scar tissue, tough, non-contractile collagen that fills the gap but can't contract like muscle. This scar tissue reduces strength and interferes with function. White blood cells clean up debris but don't become muscle. Endothelial cells form new blood vessels for healing but don't create muscle tissue. Only satellite cells have this unique regenerative power. 13. Turner syndrome results from having 45 chromosomes with only one X chromosome. Which characteristic features distinguish this condition in affected females? A. Webbed neck, short stature. B. Tall stature present. C. Advanced early puberty. D. High fertility rates. Can you guess the answer? Correct answer, A. Webbed neck, short stature. Explanation. Option A is correct because Turner syndrome causes characteristic webbed neck, short stature, broad chest, and hypergonadism due to missing or partial X chromosome. Option B is incorrect because Turner syndrome causes short stature, not tall stature, due to chromosomal abnormalities affecting growth. Option C is incorrect because Turner syndrome causes absent or delayed puberty due to gonadal dysgenesis, not advanced early puberty. Option D is incorrect because Turner syndrome typically causes infertility due to streak gonads and absence of normal ovarian function. Turner syndrome paints a unique clinical picture in affected females, resulting from a missing or incomplete X chromosome. When someone has only 45 chromosomes instead of 46 with just one X, distinctive features emerge. The webbed neck is one of the most recognizable signs. Extra skin folds create a web-like appearance between the neck and shoulders, as if nature draped excess fabric there. Short stature is universal because the missing genetic material normally guides growth. These individuals typically reach only about 4 feet, 8 inches tall without treatment. The broad chest and widely spaced nipples create another distinctive appearance. Importantly, this syndrome causes infertility due to streak gonads, underdeveloped ovaries that can't produce eggs or hormones properly. There's no tall stature, no early puberty. In fact, puberty often doesn't occur naturally at all. Without hormone replacement, sexual development remains incomplete. 14. Which vitamin deficiency causes rickets in children, resulting in soft, weak bones prone to deformities due to inadequate bone mineralization? A. Vitamin A deficiency. B. Vitamin K deficiency. C. Vitamin D deficiency. D. Vitamin C deficiency. Do you know the answer? Correct answer, C. Vitamin D deficiency. Explanation. Option C is correct because vitamin D deficiency causes rickets by impairing calcium and phosphate absorption, leading to inadequate bone mineralization and soft bones. Option A is incorrect because vitamin A deficiency affects vision and immune function, not bone mineralization and skeletal development. Option B is incorrect because vitamin K deficiency affects blood clotting factors, not calcium metabolism and bone mineralization processes. Option D is incorrect because vitamin C deficiency causes scurvy affecting collagen synthesis, not the mineralization defects seen in rickets. Rickets tells the story of what happens when young bones can't properly mineralize, and the villain is usually vitamin D deficiency. Vitamin D acts like a construction foreman, directing calcium and phosphate from your intestines into your bloodstream and then into your bones. Without enough vitamin D, this process fails catastrophically. Calcium and phosphate can't be absorbed properly from food, leaving bones soft and bendy like rubber instead of hard like concrete. Children develop bowed legs because their soft bones bend under body weight. Their growth plates can't properly ossify, leading to stunted growth and bone deformities. This isn't vitamin A deficiency affecting vision, or vitamin K affecting blood clotting, or vitamin C causing scurvy with bleeding gums. This is specifically vitamin D failing in its crucial role as the master regulator of bone mineralization, creating the soft, deformed bones characteristic of rickets. 15. In adaptive immunity, which cells produce antibodies specific to pathogens and create immunological memory for faster responses upon reinfection? A. Neutrophil phagocytes only. B. B lymphocyte cells. C. natural killer cells, D. dendritic presenting cells. Can you guess the answer? Correct answer, B. B lymphocyte cells. Explanation: option B is correct because B lymphocytes produce specific antibodies against pathogens and develop into memory cells, providing long-lasting immunity for rapid secondary responses. Option A is incorrect because neutrophils are innate immune cells that phagocytose pathogens, non-specifically without producing antibodies or memory. Option C is incorrect because natural killer cells are innate lymphocytes that destroy infected cells non-specifically without antibody production. Option D is incorrect because dendritic cells present antigens to initiate immune responses, but do not produce antibodies or form memory cells. B lymphocytes are the master weaponsmiths of your adaptive immune system, crafting precise antibodies for each specific threat. When a B cell encounters its matching antigen, it's like finding the perfect key for a lock. This triggers an incredible transformation. The B cell becomes activated and starts rapidly dividing. Some of these cells become plasma cells, which are antibody factories pumping out thousands of Y-shaped antibodies per second. These antibodies circulate through your body, binding to pathogens and marking them for destruction. But here's the brilliant part. Other B cells become memory cells, which are like a permanent record of the enemy. They can survive for decades patrolling your body. If the same pathogen appears again, these memory cells instantly recognize it and mount a massive, rapid response. This is completely different from neutrophils eating invaders non-specifically, or natural killer cells destroying infected cells without antibodies. 16. A genetic counselor explains that breast cancer risk increases with inherited BRCA mutations, but requires additional mutations. This illustrates which concept? A. Two-hit cancer hypothesis. B. Single gene determinism. C. Complete genetic penetrance. D. Random cancer occurrence. Do you know the answer? Correct answer, A. Two-hit cancer hypothesis. Explanation: option A is correct, because the two-hit hypothesis explains that inherited BRCA mutations provide the first hit, but a second somatic mutation is needed for cancer development. Option B is incorrect because single gene determinism would mean one mutation alone causes disease, not requiring additional genetic changes. Option C is incorrect because complete penetrance would mean all mutation carriers develop cancer, not just increased risk requiring a second hit. Option D is incorrect because this describes a predictable genetic mechanism with inherited predisposition, not random cancer occurrence without a genetic basis. The BRCA gene story perfectly illustrates the two-hit hypothesis in hereditary cancer risk. Think of BRCA genes as quality control inspectors in your cells, constantly checking DNA for errors and fixing them. When you inherit a mutated BRCA gene from a parent, you're born with one inspector already fired. That's your first hit. You still have one good copy from your other parent, which usually keeps cancer at bay. But here's the critical point. You're now walking a tightrope with no safety net. All it takes is one more mutation in that remaining good gene, a second hit from environmental damage or random copying errors, and you've lost both inspectors. Without these guardians, DNA damage accumulates unchecked, leading to cancer. This explains why BRCA mutation carriers have increased risk but not certainty of cancer. They need that second hit. It's not a single gene determining fate, but a two-step process. 17. During bone remodeling, calcitonin from the thyroid gland primarily functions to regulate calcium homeostasis through which mechanism? A. Stimulating osteoclast activity. B. Inhibiting calcium absorption. C. Increasing parathyroid hormone production. D. Promoting bone calcium deposition. Can you guess the answer? Correct answer, D. Promoting bone calcium deposition. Explanation. Option D is correct because calcitonin promotes calcium deposition into bones by inhibiting osteoclast activity and enhancing osteoblast function, lowering blood calcium levels. Option A is incorrect because calcitonin inhibits rather than stimulates osteoclast activity, reducing bone breakdown and calcium release. Option B is incorrect because calcitonin primarily affects bone calcium deposition, not intestinal calcium absorption, which vitamin D regulates. Option C is incorrect because calcitonin and parathyroid hormone are antagonistic hormones. Calcitonin doesn't increase parathyroid hormone production, but opposes its effects. Calcitonin is your body's calcium-lowering hormone, working like a wise treasurer who stores wealth rather than spending it. Produced by your thyroid gland, calcitonin springs into action when blood calcium levels rise too high. Its primary mechanism is elegant. It tells osteoclast, the bone-breaking cells, to take a break, literally stopping them from demolishing bone and releasing more calcium. Simultaneously, it encourages osteoblasts to work harder, pulling calcium from the blood and depositing it into bone tissue, like depositing money in a savings account. This creates stronger, denser bones while lowering dangerous blood calcium levels. This is the opposite of PTH, which breaks down bone to raise blood calcium. Calcitonin doesn't block intestinal absorption or increase PTH. Those would work against its purpose. It's all about promoting bone storage, making bones the calcium bank of your body. 18. Which type of muscle injury results from direct impact crushing muscle fibers, causing bluish discoloration, swelling, and localized pain? A. Strain overstretch injury. B. Sprain ligament tear. C. Contusion bruise injury. D. Avulsion tendon separation. Do you know the answer? Correct answer. C. Contusion bruise injury. Explanation. Option C is correct because muscle contusions result from direct blows that crush muscle fibers, causing bleeding that appears as bruising with swelling and pain. Option A is incorrect because strains result from overstretching or tearing muscles or tendons. Option B is incorrect because sprains affect ligaments around joints, not muscle tissue, and result from twisting rather than impact. Option D is incorrect because avulsion injuries involve tendons or ligaments pulling away from bone, not direct muscle fiber crushing. A muscle contusion, commonly called a bruise, happens when your muscle experiences blunt force trauma. Imagine a hammer striking a water balloon. The impact doesn't break the skin, but it crushes everything underneath. The direct blow compresses muscle fibers against underlying bone, literally crushing them between two hard surfaces. Blood vessels within the muscle rupture, and blood leaks into the surrounding tissue. This pooled blood creates the characteristic bluish-purple discoloration we see as bruising. The area swells as inflammatory fluid rushes in, and pain receptors fire intensely from the tissue damage. This is distinctly different from a strain, where muscles are overstretched like a rubber band pulled too far, or a sprain affecting ligaments, or an avulsion where tissue tears away from bone. A contusion is pure impact injury, direct trauma crushing tissue. 19. Mosaicism in genetic disorders occurs when cells within the same individual have different chromosome numbers. How does this affect disease expression? A. Variable symptom manifestation. B. Uniform severe symptoms. C. Complete disease prevention. D. Enhanced genetic stability. Can you guess the answer? Correct answer. A. Variable symptom manifestation. Explanation. Option A is correct because mosaicism causes variable symptoms because some cells have normal chromosomes while others have abnormalities, creating mixed phenotypic expression. Option B is incorrect because mosaicism typically causes milder or variable symptoms, not uniform severe manifestations throughout the body. Option C is incorrect because mosaicism doesn't prevent disease but rather modifies its expression depending on affected cell distribution. Option D is incorrect because mosaicism represents chromosomal instability and errors during development, not enhanced genetic stability. Mosaicism creates a genetic patchwork quilt within a single person, explaining why genetic disorders can show such variable symptoms. During early embryonic development, an error occurs in cell division. Some cells end up with the normal chromosome number, while others have too many or too few. Imagine planting a garden where some seeds are regular and others are mutant. You get a mixed result. As these cells multiply, the person develops with two or more genetically different cell populations. If the abnormal cells cluster in critical organs, symptoms are severe there. If they're scattered or in less critical areas, symptoms are milder. This creates huge variability. Two people with mosaic Down syndrome might look completely different, with one severely affected and another having mild symptoms. It's not uniform severity, not prevention, and definitely not genetic stability. It's nature's way of creating a mixed genetic picture. 20. A patient with osteomalacia experiences bone pain and muscle weakness. This adult condition parallels which childhood disorder with similar pathophysiology? A. Osteogenesis imperfecta condition. B. Achondroplasia dwarfism syndrome. C. Muscular dystrophy disease. D. Rickets vitamin deficiency. Do you know the answer? Correct answer: D. Rickets vitamin deficiency. Explanation: Option D is correct because osteomalacia is adult rickets, both caused by vitamin D deficiency or calcium deficiency leading to soft, painful, undermineralized bones. Option A is incorrect because osteogenesis imperfecta is a genetic collagen disorder causing brittle bones, not vitamin deficiency-related softening. Option B is incorrect because achondroplasia is a genetic disorder affecting cartilage growth causing dwarfism, not bone mineralization problems. Option C is incorrect because muscular dystrophy affects muscle tissue directly through genetic mutations, not bone mineralization defects. Osteomalacia in adults mirrors a childhood disease we know well: rickets. Both conditions share the same root cause: failure of bone mineralization due to vitamin D or calcium deficiency. Think of bones like concrete that never properly hardened. In children, we call this rickets because their growing bones become deformed. In adults whose bones have stopped growing, we call it osteomalacia, but the pathophysiology is identical. Without adequate vitamin D, the intestines can't absorb calcium and phosphate properly. Bones become soft, painful, and weak, like chalk instead of stone. Patients experience deep aching bone pain and muscle weakness because calcium is essential for muscle function too. This isn't osteogenesis imperfecta with its genetic collagen defect, or achondroplasia affecting cartilage growth, or muscular dystrophy attacking muscle directly. This is the adult version of rickets. Same disease, different age. 21. Which component of synovial joints provides smooth, frictionless movement by covering bone ends and is progressively lost in osteoarthritis? A. Synovial membrane lining. B. Articular cartilage covering. C. Joint capsule structure. D. Surrounding muscle tissue. Can you guess the answer? Correct answer: B. Articular cartilage covering. Explanation: Option B is correct because articular cartilage covers the bone ends in synovial joints, providing a smooth surface for frictionless movement. In osteoarthritis, this cartilage deteriorates, leading to pain and reduced mobility. Option A is incorrect because the synovial membrane lines the joint cavity and produces synovial fluid, which lubricates the joint, but it doesn't provide the smooth surface for movement. Option C is incorrect because the joint capsule encloses the joint and provides stability but does not directly contribute to the smooth articular surface. Option D is incorrect because surrounding muscle tissue supports and moves the joint, but it's the cartilage that facilitates frictionless movement between the bones. Let's uncover the secret to smooth, painless joint movement. Articular cartilage, the unsung hero of every synovial joint. This specialized tissue covers the ends of bones like a protective cap, but it's so much more than just protection. Imagine the smoothest ice rink you've ever seen. Articular cartilage is actually smoother, with a coefficient of friction lower than ice on ice. It's composed of specialized cells called chondrocytes, embedded in a matrix that's both firm and flexible. In healthy joints, this allows bones to glide past each other thousands of times daily, without pain or damage. But in osteoarthritis, this cartilage progressively deteriorates, wearing away like tire treads. Eventually, you're left with bone grinding on bone, causing the severe pain and stiffness patients experience. The synovial membrane produces fluid, the joint capsule provides structure, and muscles provide power, but only articular cartilage provides that crucial, frictionless surface. 22. Advanced maternal age increases risk for which chromosomal abnormality caused by non-disjunction during meiosis, resulting in intellectual disability? A. Down syndrome trisomy. B. Turner syndrome monosomy. C. Cystic fibrosis mutation. D. Sickle cell anemia. Do you know the answer? Correct answer, A. Down syndrome trisomy. Explanation: option A is correct because advanced maternal age increases Down syndrome risk through non-disjunction errors during meiosis, causing trisomy 21 and intellectual disability. Option B is incorrect because Turner syndrome involves a missing X chromosome and, while age-related, is less strongly correlated than Down syndrome. Option C is incorrect because cystic fibrosis is an autosomal recessive genetic mutation, not related to maternal age or chromosomal non-disjunction. Option D is incorrect because sickle cell anemia is an inherited hemoglobin mutation, unrelated to maternal age or chromosomal number abnormalities. Advanced maternal age dramatically increases the risk of Down syndrome through a fascinating yet concerning biological mechanism. As women age, their eggs age too. They've been waiting in the ovaries since before birth. Think of it like a library where books have been sitting on shelves for decades. The binding weakens over time. In eggs, the proteins holding chromosomes together during cell division weaken with age. During meiosis, when the egg prepares for fertilization, these aged proteins can't properly separate chromosome 21. This non-disjunction error means both copies go to one cell instead of splitting evenly. The risk skyrockets from 1 in 1,500 at age 20 to 1 in 50 at age 45. This isn't Turner syndrome with its missing X chromosome, or cystic fibrosis, which is a gene mutation unrelated to age, or sickle cell anemia, which is inherited. This is specifically about how time affects egg quality and chromosome separation. 23. Following fracture, which healing stage occurs approximately 6 weeks post-injury when osteoblasts and chondroblasts form new bone and cartilage? A. Initial inflammatory response. B. Final remodeling phase. C. Callus formation stage. D. Immediate hematoma formation. Can you guess the answer? Correct answer, C. Callus formation stage. Explanation. Option C is correct because callus formation occurs around 6 weeks post-fracture, when osteoblasts and chondroblasts create new bone and cartilage, bridging the fracture. Option A is incorrect because the inflammatory response peaks within 48 hours after fracture, not at 6 weeks post-injury. Option B is incorrect because remodeling is the final stage, occurring 3 to 6 months post-fracture, after callus formation. Option D is incorrect because hematoma formation occurs immediately after fracture as blood collects at the injury site. The 6-week mark after a fracture represents a crucial milestone in bone healing, callus formation. After the initial inflammatory storm and granulation tissue bridge, the body begins serious reconstruction. At 6 weeks, specialized cells called osteoblasts and chondroblasts arrive like skilled craftsmen. The chondroblasts first lay down cartilage, creating a soft callus that acts like scaffolding. Meanwhile, osteoblasts begin depositing actual bone material, gradually converting this soft callus into hard callus. Think of it like building a house. First you put up the framework, then you add the solid walls. This isn't the immediate inflammatory response that happens within hours, or the final remodeling that takes months. This 6-week stage is when the break actually starts becoming bone again. You can often see this cloudy callus on X-rays, proof that new bone is forming. It's still fragile, but it's the beginning of true structural repair. 24. In autoimmune disorders, the immune system inappropriately attacks the body's own tissues. Which disease exemplifies this with butterfly rash presentation? A. Immunodeficiency syndrome condition. B. Systemic lupus erythematosus. C. Allergic reaction response. D. Bacterial infection disease. Do you know the answer? Correct answer, B. Systemic lupus erythematosus. Explanation. Option B is correct because systemic lupus erythematosus is an autoimmune disorder causing antibodies against self-components, presenting with characteristic malar butterfly rash. Option A is incorrect because immunodeficiency involves inadequate immune responses to pathogens, not overactive responses against self-tissues. Option C is incorrect because allergic reactions involve hypersensitivity to external antigens, not autoimmune attacks on body tissues. Option D is incorrect because bacterial infections involve pathogen invasion, not the immune system attacking the body's own tissues. Systemic lupus erythematosus represents the classic autoimmune disease where your immune system becomes your own worst enemy. The hallmark butterfly rash spreads across the cheeks and nose like a red butterfly landed on the face. But why does this happen? In lupus, the immune system loses its ability to distinguish self from non-self. It produces autoantibodies, antibodies that attack your own tissues. These antibodies target multiple components, including DNA, blood cells, and organs. The malar rash occurs because sun exposure triggers immune complexes to deposit in the skin, causing inflammation. This distinctive pattern helps doctors recognize lupus. This isn't immunodeficiency, where the immune system is too weak, or an allergic reaction to something external, or a bacterial infection from outside invaders. This is your immune system actively attacking healthy tissue, creating inflammation throughout the body. The butterfly rash is just the visible sign of this internal war. 25. Complement proteins work together in cascade fashion to identify and destroy pathogens. Which naming convention identifies most complement system proteins? A. C1 through C9, B. Letters A through Z, C. Roman numeral sequence, D. Greek alphabet letters. Can you guess the answer? Correct answer, A. C1 through C9. Explanation. Option A is correct because complement proteins are named C1 through C9, with each protein activating the next in sequence to destroy pathogens effectively. Option B is incorrect because complement proteins use numbered C designations, not alphabetical letters, A through Z for identification. Option C is incorrect because Roman numerals are used for clotting factors, not for naming complement system immune proteins. Option D is incorrect because Greek letters are used for other biological molecules, not for complement cascade protein designation. The complement system operates like a precisely numbered military unit, with most proteins designated C1 through C9. This naming convention isn't random. It reflects the cascade nature of complement activation. C1 starts the classical pathway, like the first domino falling. It activates C2 and C4, which combine to activate C3, and so on through the sequence. Each numbered protein has a specific role in the cascade, like players in a relay race passing the baton. The numbers help scientists and clinicians track exactly where problems occur. If someone has C3 deficiency, we know precisely which step in the cascade fails. This isn't like using letters A through Z, Roman numerals for clotting factors, or Greek letters for other proteins. The complement system has its own numerical language, C1 through C9, making it easy to understand the sequential activation that ultimately creates the membrane attack complex destroying pathogens. 26. Which cells in innate immunity engulf and destroy pathogens through phagocytosis as a first-line cellular defense without requiring prior exposure? A. Memory B cells. B. Cytotoxic T lymphocytes. C. Plasma antibody cells. D. Neutrophils and macrophages. Do you know the answer? Correct answer, D. Neutrophils and macrophages. Explanation. Option D is correct because neutrophils and macrophages are innate immune phagocytes that engulf pathogens immediately without requiring prior exposure or specific recognition. Option A is incorrect because memory B cells are adaptive immune cells requiring initial antigen exposure to form and provide specific immunity. Option B is incorrect because cytotoxic T lymphocytes are adaptive immune cells requiring antigen presentation and activation for specific killing. Option C is incorrect because plasma cells produce antibodies as part of adaptive immunity after B cell activation, not innate phagocytosis. Neutrophils and macrophages are the professional eaters of your innate immune system, ready to devour invaders within minutes of detection. These phagocytes don't need introduction cards or prior meetings with pathogens. They attack on sight. Neutrophils are the rapid response team, arriving first at infection sites within minutes to hours. They're like cellular vacuum cleaners, engulfing bacteria, dead cells and debris. Macrophages are the heavy-duty cleanup crew, arriving later but staying longer. They can engulf larger particles and more of them. The process of phagocytosis is remarkable. These cells literally wrap their membrane around the pathogen, pull it inside, and digest it with powerful enzymes. This is fundamentally different from memory B cells that need prior exposure, cytotoxic T cells that require activation, or plasma cells that produce antibodies. Neutrophils and macrophages are always ready, providing immediate defense without any learning curve. 27. A tendon overstretching injury commonly affecting the lower back, and hamstring from overuse or improper movement represents which soft tissue injury? A. Muscle strain injury. B. Ligament sprain injury. C. Bone stress fracture. D. Joint dislocation trauma. Can you guess the answer? Correct answer, A. Muscle strain injury. Explanation. Option A is correct because muscle strains involve overstretching or tearing of muscles or tendons, often occurring in the lower back and hamstring due to overuse or improper movement. Option B is incorrect because sprains affect ligaments, which connect bones at joints, not the muscle tendon units described in the question. Option C is incorrect because stress fractures are small cracks in bones caused by repetitive force, not soft tissue overstretching. Option D is incorrect because dislocations involve bones moving out of their normal joint position, not muscle or tendon injuries. A muscle strain tells the story of tissues pushed beyond their limits, specifically affecting the muscle tendon unit. Picture a rubber band being stretched. There's a point where the elastic fibers start to tear. That's exactly what happens in a strain. The muscle fibers or the tendons connecting muscle to bone get overstretched during activities like lifting something too heavy or making a sudden movement. The lower back and hamstring are particularly vulnerable because they're constantly under tension during daily activities. When you bend to pick something up, these muscles lengthen under load. Poor technique or fatigue can cause them to overstretch and tear. This creates pain, weakness, and sometimes a popping sensation. This isn't a sprain where ligaments connecting bones tear, or a stress fracture in bone, or a joint dislocation. A strain specifically involves the contractile unit, the muscle and its tendon being pulled beyond capacity. 28. Osteophyte formation represents a hallmark finding in osteoarthritis. These bone spurs can cause complications by impinging on which structures? A. Only joint capsules, bar, muscle bellies only. C. Nerves and vessels. D. Skin surface areas. Do you know the answer? Correct answer, C. Nerves and vessels. Explanation. Option C is correct because osteophytes in osteoarthritis can impinge on nearby nerves and blood vessels, causing pain, neurological symptoms, and circulation problems. Option A is incorrect because osteophytes affect multiple structures beyond joint capsules, including nerves and blood vessels as described. Option B is incorrect because osteophytes primarily affect nerves and vessels near joints rather than muscle bellies away from articulations. Option D is incorrect because osteophytes are internal bone projections that don't typically reach or affect external skin surfaces. Osteophytes, or bone spurs, represent the dark side of your body's attempt to stabilize an arthritic joint. As cartilage wears away in osteoarthritis, the bone tries to compensate by growing outward, forming these bony projections. Think of them as misguided repair attempts, like adding extra support beams that end up blocking the hallway. These spurs don't just affect the joint capsule, they can impinge on critical structures passing nearby. Nerves running close to the joint can be compressed, causing shooting pain, numbness, or weakness down the limb. Blood vessels can also be compressed, potentially reducing circulation. In the spine, osteophytes can narrow the spaces where nerves exit, causing radiculopathy. In the knee, they can irritate surrounding tissues with every movement. They don't typically affect distant muscle bellies or reach the skin surface. The real danger is their location near neurovascular structures, turning a joint problem into a nerve and circulation problem. 29. During pregnancy, alcohol crosses the placenta affecting fetal development. No safe amount exists, but which timing causes greatest risk? A. Only third trimester. B. Throughout entire pregnancy. C. Only during labour. D. Post-delivery period only. Can you guess the answer? Correct answer, B. Throughout entire pregnancy. Explanation. Option B is correct because alcohol can harm the fetus throughout the entire pregnancy as brain development occurs continuously, with no safe period for consumption. Option A is incorrect because alcohol causes harm throughout pregnancy, not just the third trimester, affecting multiple developmental stages. Option C is incorrect because fetal alcohol exposure during pregnancy, not labour alone, causes the developmental abnormalities seen. Option D is incorrect because post-delivery alcohol doesn't cause fetal alcohol spectrum disorders, though it affects breastfeeding. There's a cruel truth about alcohol and pregnancy. There's never a safe time to drink. The developing fetal brain is constantly forming new connections and structures throughout all 9 months. In the first trimester, alcohol disrupts the formation of basic brain structures and can cause facial abnormalities. The second trimester sees rapid brain growth and neuron migration. Alcohol interferes with cells finding their proper locations. The third trimester involves synapse formation and myelination. Alcohol damages these delicate processes. Even small amounts can cause harm because alcohol freely crosses the placenta. reaching the same concentration in the fetus as in the mother. But the fetus can't metabolize alcohol like an adult can. It's not just about visible birth defects. It's about intellectual disabilities, behavioral problems, and learning difficulties that last a lifetime. The only safe amount of alcohol during pregnancy is 0, from conception through delivery. 30. Vitamin D activation involves multiple organs. Which hormone stimulates both osteoclast activity and vitamin D production for calcium regulation? A. Parathyroid hormone. B. Calcitonin thyroid hormone. C. Growth hormone only. D. Insulin pancreatic hormone. Do you know the answer? Correct answer, A. Parathyroid hormone. Explanation. Option A is correct because parathyroid hormone stimulates osteoclast bone breakdown and activates vitamin D production, both mechanisms increasing blood calcium when levels drop. Option B is incorrect because calcitonin opposes parathyroid hormone by inhibiting osteoclasts and promoting calcium deposition, not vitamin D activation. Option C is incorrect because growth hormone primarily affects bone growth and metabolism, not calcium homeostasis through vitamin D. Option D is incorrect because insulin regulates glucose metabolism, not calcium homeostasis or vitamin D activation in bones. Parathyroid hormone, or PTH, is the master regulator of calcium, orchestrating multiple systems to raise blood calcium when it drops. These 4 tiny glands behind your thyroid act like calcium sensors. When blood calcium falls, they release PTH, which immediately targets bones, kidneys, and intestines. In bones, PTH activates osteoclast to break down bone tissue, releasing stored calcium into the bloodstream. Think of it as making a withdrawal from the calcium bank, but PTH does more. It stimulates the kidneys to activate vitamin D, converting it to its active form, calcitriol. This activated vitamin D then enhances calcium absorption from food in your intestines. PTH also tells kidneys to reabsorb more calcium instead of losing it in urine. This is opposite to calcitonin, which lowers calcium. It's not growth hormone or insulin. This is specifically about PTH's dual role in mobilizing calcium and activating vitamin D. 31. Which type of immunity develops through vaccination or natural infection, creating specific antibodies and memory cells for long-term pathogen protection? A. Passive maternal immunity. B. Non-specific immediate immunity. C. Innate barrier immunity. D. Adaptive acquired immunity. Can you guess the answer? Correct answer, D. Adaptive acquired immunity. Explanation. Option D is correct because adaptive immunity develops through exposure via infection or vaccination, producing specific antibodies and memory cells for lasting protection. Option A is incorrect because passive immunity involves receiving pre-formed antibodies temporarily, not developing active memory cell responses. Option B is incorrect because non-specific immunity doesn't create pathogen-specific antibodies or memory cells as described in the question. Option C is incorrect because innate immunity exists from birth without requiring exposure, lacking the specific memory described. Adaptive immunity is like attending a university, where your immune system learns to recognize and remember specific threats. Unlike innate immunity that you're born with, adaptive immunity must be acquired through experience. When you encounter a pathogen naturally or through vaccination, specialized lymphocytes study its unique features. B cells learn to produce custom antibodies that fit the pathogen like a key in a lock. T cells learn to recognize infected cells displaying pathogen fragments. But here's the brilliant part. After defeating the threat, some of these educated cells become memory cells. They're like security guards who never forget a face. Years or decades later, if that same pathogen appears, these memory cells launch an immediate, powerful response. This is why you typically get chickenpox only once, and why vaccines work. It's not passive immunity, where you borrow antibodies temporarily, or innate immunity that never changes. This is your immune system's education system, getting smarter with each exposure. 32. Which fracture type results from repetitive force application, causing small cracks in bone, commonly seen in athletes and military recruits? A. Stress microfracture type. B. Comminuted shattered fracture. C. Spiral twisting fracture. D. Green stick partial fracture. Do you know the answer? Correct answer. A. Stress microfracture type. Explanation. Option A is correct because stress fractures are small cracks that develop from repetitive force application, a common injury among athletes and military recruits during training. Option B is incorrect because comminuted fractures result from high-impact trauma, causing the bone to shatter into multiple pieces. Option C is incorrect because spiral fractures are caused by rotational forces, creating a corkscrew pattern in the bone. Option D is incorrect because green stick fractures are incomplete breaks, typically occurring in the flexible bones of children. Stress fractures are the injury of too much, too often, too soon. Unlike traumatic fractures from a single impact, stress fractures develop gradually from repetitive force. Imagine bending a paperclip back and forth. Eventually it cracks without any single bend being excessive. That's what happens in bones subjected to repeated stress. Athletes and military recruits are particularly vulnerable because their training involves repetitive impact activities, like running and marching. Each foot strike sends force through the bones. Normally, bones adapt by getting stronger, but if the repetitive stress exceeds the bone's ability to repair itself, micro cracks accumulate. These tiny cracks coalesce into a stress fracture, causing increasing pain with activity. This isn't a comminuted fracture with bone shattered into pieces, or a spiral fracture from twisting, or a green stick fracture in flexible young bones. This is fatigue failure from repetitive loading, the bone's version of being overworked. 33. Systemic lupus erythematosus produces antibodies against multiple self-components. Which laboratory test typically shows positive results in this condition? A. Negative blood cultures. B. Low white cell count. C. Anti-nuclear antibody test. D. Decreased platelet count. Can you guess the answer? Correct answer, C. Anti-nuclear antibody test. Explanation. Option C is correct because the anti-nuclear antibody test typically shows positive results in lupus, as the immune system produces antibodies against nuclear components. Option A is incorrect because blood cultures test for bacterial infections, not autoimmune antibodies characteristic of lupus erythematosus. Option B is incorrect because lupus may cause various blood count abnormalities, but a low white cell count isn't the diagnostic test. Option D is incorrect because while lupus can affect platelets, decreased counts aren't the specific diagnostic test for lupus. The anti-nuclear antibody test, or ANA, serves as a crucial detective tool for diagnosing lupus. This test looks for antibodies that target the nucleus, the command center of your cells. In healthy people, the immune system ignores the nucleus, recognizing it as self. But in lupus, the immune system creates antibodies against nuclear components like DNA and histones. When we run an ANA test, we're essentially asking, is your immune system attacking your own cell nuclei? A positive ANA means these autoantibodies are present, though it doesn't automatically mean lupus. Other conditions can cause positive results too, but in someone with symptoms like the butterfly rash, joint pain and fatigue, a positive ANA strongly suggests lupus. This isn't looking for bacteria in blood cultures or counting white cells, or measuring platelets. This test specifically identifies the autoimmune attack on nuclear material that characterizes lupus, making it a cornerstone of diagnosis. 34. In cystic fibrosis, defective protein affecting chloride transport causes thick mucus secretions. Which organ system experiences recurrent infections from mucus buildup? A. Cardiovascular vessels only. B. Respiratory lung system. C. Skeletal bone structure. D. Integumentary skin surface. Do you know the answer? Correct answer, B. Respiratory lung system. Explanation. Option B is correct because cystic fibrosis causes thick mucus buildup in the lungs, which leads to recurrent respiratory infections and progressive lung damage. Option A is incorrect because while cystic fibrosis can affect multiple organs, the cardiovascular vessels are not primarily affected by mucus buildup. Option C is incorrect because skeletal bones are not affected by the mucus secretion problems characteristic of cystic fibrosis. Option D is incorrect because the skin mainly shows increased salt in sweat, not the mucus buildup causing recurrent infections. Cystic fibrosis transforms the respiratory system into a breeding ground for dangerous infections through a cruel mechanism. The defective CFTR protein can't properly transport chloride across cell membranes. This causes mucus that should be thin and watery to become thick and sticky, like honey instead of water. In the lungs, this thick mucus clogs airways like pouring concrete into pipes. Normally, thin mucus traps bacteria and cilia sweep it out, but thick CF mucus can't be cleared. Bacteria become trapped in this sticky environment, setting up permanent colonies. The warm, moist, nutrient-rich mucus is paradise for bacteria. Patients suffer recurrent pneumonias, with organisms like Pseudomonas taking up permanent residence. Each infection causes more inflammation and scarring, progressively destroying lung tissue. Eventually, patients may develop pneumothorax from weakened lungs. While CF affects other organs, the respiratory system bears the brunt, with lung disease being the primary cause of mortality. 35. Duchenne muscular dystrophy causes progressive muscle weakness due to dystrophin protein deficiency. This condition follows which inheritance pattern? A. X-linked recessive pattern. B. Autosomal dominant inheritance. C. Mitochondrial maternal transmission. D. Y-linked male inheritance. Can you guess the answer? Correct answer, A. X-linked recessive pattern. Explanation. Option A is correct because Duchenne muscular dystrophy is typically inherited through an X-linked recessive pattern, where males are predominantly affected due to having only one X chromosome. Option B is incorrect because autosomal dominant inheritance requires only one copy of the mutated gene to be present, and it affects both sexes equally, which is not the case with Duchenne muscular dystrophy. Option C is incorrect because mitochondrial inheritance is passed down from the mother to all offspring, and it does not explain the observed inheritance pattern in Duchenne muscular dystrophy. Option D is incorrect because Y-linked inheritance only affects males and is passed directly from father to son, which is not how Duchenne muscular dystrophy is inherited. Duchenne muscular dystrophy follows an X-linked recessive inheritance pattern, creating a unique genetic situation. The dystrophin gene sits on the X chromosome. Males have only one X chromosome, so if they inherit a mutated dystrophin gene, they have no backup copy. They will develop the disease. Females have two X chromosomes, so even with one mutated gene, the normal copy on their other X chromosome usually protects them. They become carriers. Here's how it works. Carrier mothers have a 50% chance of passing the mutated X to each child. Sons who inherit it develop Duchenne, while daughters who inherit it become carriers. Affected males rarely reproduce due to disease severity, so the disease primarily passes through carrier females. This X-linked pattern explains why Duchenne almost exclusively affects boys. It's not autosomal dominant, affecting both sexes equally, not mitochondrial passing from mothers to all children, and definitely not Y-linked, which would only pass father to son. 36. Which bone disease shows 3 distinct phases, starting with aggressive osteoclast activity, then mixed activity, and finally sclerotic bone formation? A. Osteoporosis progression stages. B. Osteomalacia development phases. C. Rickets childhood progression. D. Paget disease phases. Do you know the answer? Correct answer, D. Paget disease phases. Explanation. Option D is correct because Paget disease progresses through lytic, mixed and sclerotic phases with initially aggressive osteoclast activity followed by disorganized bone formation. Option A is incorrect because osteoporosis involves continuous imbalanced bone loss without distinct phases of osteoclast then osteoblast activity. Option B is incorrect because osteomalacia involves continuous undermineralization without the distinct phases of cellular activity described. Option C is incorrect because rickets involves undermineralization during growth without the 3 distinct phases of Paget disease. Paget disease of bone unfolds like a 3-act play, each phase with distinct cellular chaos. Phase 1, the lytic phase, starts with osteoclasts going rogue, aggressively breaking down bone like an out-of-control demolition crew. Phase 2, the mixed phase, adds construction to ongoing demolition. Osteoblasts frantically build while osteoclasts still destroy, creating architectural chaos. Phase 3, the sclerotic phase, sees construction finally overtake destruction. Osteoblasts dominate, laying down excessive but disorganized bone. The result is paradoxical. Bones become thicker, but weaker, like a building made with too much poorly arranged material. Blood vessels proliferate through this chaotic bone, making it highly vascular. Eventually, both cell types exhaust themselves, entering a dormant state. This 3-phase progression is unique to Paget disease. It's not the continuous imbalance of osteoporosis, the undermineralization of osteomalacia, or the poor mineralization of rickets. This is a distinct pattern of destruction, chaos, then excessive but weak construction. 37. Following spinal cord injury, continuous neurovascular assessments monitor pulses, sensation, colour, and function. Why are these assessments critical? A. Preventing irreversible dysfunction. B. Monitoring bone healing. C. Assessing muscle strength. D. Evaluating joint mobility. Can you guess the answer? Correct answer, A. Preventing irreversible dysfunction. Explanation. Option A is correct because nerve and vascular damage can cause irreversible dysfunction if not detected and treated promptly. Option B is incorrect because bone healing monitoring involves different assessments like X-rays, not the neurovascular checks described. Option C is incorrect because muscle strength assessment uses different scales and tests, not the neurovascular monitoring parameters listed. Option D is incorrect because joint mobility evaluation involves range of motion testing, not neurovascular status monitoring. After spinal cord injury, neurovascular assessments become a race against time to prevent permanent damage. The nervous system doesn't forgive delays. Once neurons die from lack of oxygen or compression, they don't regenerate. That's why we continuously monitor 4 critical parameters. Pulses tell us if blood is reaching the extremities. Without adequate blood flow, tissues die within hours. Sensation reveals if nerve signals are travelling properly. Loss of sensation often precedes complete paralysis. Colour indicates tissue perfusion. Pallor means inadequate blood supply, while cyanosis signals oxygen deprivation. Function tests if motor neurons are intact. Together, these assessments create an early warning system. A change in any parameter demands immediate action. This isn't about monitoring bone healing, which takes weeks. It's not measuring muscle strength for rehabilitation. It's not evaluating joint flexibility. This is about catching neurovascular compromise before it becomes irreversible, preventing lifetime paralysis or limb loss. 38. Memory cells in adaptive immunity provide rapid responses upon pathogen re-exposure. Which population has fewer memory cells, increasing infection susceptibility? A. Middle-aged healthy adults. B. Vaccinated adolescent population. C. Young children population. D. Athletic adult population. Do you know the answer? Correct answer, C. Young children population. Explanation. Option C is correct because young children have not yet been exposed to many pathogens or vaccines, resulting in fewer memory cells and increased susceptibility to infection. Option A is incorrect because middle-aged adults have had many years to develop immunological memory through exposure to pathogens and vaccines. Option B is incorrect because vaccinated adolescents have developed memory cells specific to the pathogens targeted by the vaccines. Option D is incorrect because athletic adults tend to have robust immune systems and are not necessarily deficient in memory cells. Young children face a unique immunological challenge. They haven't had time to build their antibody library. Memory cells are like stamps in a collection. You only get them by encountering specific pathogens. A newborn starts with almost no memory cells, just temporary antibodies borrowed from mum. Each infection or vaccination adds new memory cells to their collection. By adulthood, you've accumulated thousands of different memory cells, ready to recognize old enemies. But young children are still building this collection. When they encounter a new pathogen, they must mount a primary immune response, which is slower and weaker than the memory response adults can generate against familiar threats. They're more susceptible to infections simply because most pathogens are new to them. It's not that middle-aged adults, vaccinated adolescents, or athletes have fewer memory cells. They have more. Children's vulnerability comes from their immunological inexperience, making every infection a first-time learning experience for their immune system. 39. Achondroplasia causing disproportionate short stature follows autosomal dominant inheritance. What percentage chance exists for affected parent transmission? A. 25% chance. B. 50% chance. C. 75% chance. D. 100% chance. Can you guess the answer? Correct answer, B. 50% chance. Explanation. Option B is correct because autosomal dominant conditions like achondroplasia have a 50% transmission chance from an affected parent to a child per pregnancy. Option A is incorrect because a 25% chance is typical for autosomal recessive conditions when both parents are carriers. Option C is incorrect because a 75% transmission chance does not match standard Mendelian inheritance patterns for single gene disorders. Option D is incorrect because a 100% chance is incorrect. Autosomal dominant means there is a 50% chance per child. Achondroplasia's autosomal dominant inheritance pattern creates an interesting genetic situation with clear mathematical probabilities. Autosomal dominant means you only need one mutated gene copy to express the condition. If one parent has achondroplasia, they have one normal and one mutated gene. During reproduction, each child has a 50-50 chance of inheriting either gene. It's like flipping a coin for each pregnancy. If the child inherits the mutated gene, they'll have achondroplasia. If they inherit the normal gene, they won't. This 50% transmission rate is consistent across all autosomal dominant conditions. The text incorrectly states 100%, but that would only occur if the parent had two mutated copies, which is usually lethal in achondroplasia. 25% would apply to recessive conditions with carrier parents. 75% doesn't match any standard inheritance pattern. The correct answer is 50%. A coin flip for each child. 40. Leukemia involves uncontrolled proliferation of malignant leukocytes. Which diagnostic procedure confirms this diagnosis by examining bone marrow cells? A. Bone biopsy procedure. B. Blood culture test. C. Urine analysis test. D. Skin biopsy sample. Do you know the answer? Correct answer, A. Bone biopsy procedure. Explanation: option A is correct because a bone marrow biopsy from the posterior iliac crest examines cells directly to confirm a leukemia diagnosis and determine the specific type. Option B is incorrect because blood cultures detect bacterial infections, not the malignant cell proliferation characteristic of leukemia. Option C is incorrect because urine analysis does not examine bone marrow cells needed for a definitive leukemia diagnosis. Option D is incorrect because skin biopsies examine dermal tissue, not the bone marrow where leukemia originates. Diagnosing leukemia requires looking directly at the source, the bone marrow where blood cells are manufactured. A bone marrow biopsy from the posterior iliac crest provides the definitive diagnosis. The iliac crest, the upper curved part of your hip bone, offers a large accessible area with plenty of marrow. Using a special needle, doctors extract both liquid marrow and a small core of bone. Under the microscope, they can see the chaos, immature white blood cells crowding out normal cells. They can identify whether it's acute or chronic, myeloid or lymphoid leukemia. This direct examination reveals the specific genetic mutations and cell markers that determine treatment. Blood tests might show abnormal counts, but they can't definitively diagnose leukemia type. Blood cultures look for infections, not cancer cells. Urine tests don't reflect bone marrow activity. Skin biopsies examine surface tissues, not blood cell production. Only bone marrow biopsy provides the complete picture needed for diagnosis and treatment planning. 41. Which inflammatory mediator causes increased vascular permeability during acute inflammation, leading to fluid accumulation and exudate formation at injury sites? A. Calcium ions only. B. Vitamin D metabolites. C. Complement cascade proteins. D. Parathyroid hormone secretion. Can you guess the answer? Correct answer, C. Complement cascade proteins. Explanation: option C is correct because complement proteins contribute to inflammation by increasing vascular permeability, allowing fluid and cells to enter tissues forming exudate. Option A is incorrect because calcium ions primarily function in bone metabolism and muscle contraction, not inflammatory vascular permeability. Option B is incorrect because vitamin D metabolites regulate calcium absorption and bone health, not acute inflammatory responses. Option D is incorrect because parathyroid hormone regulates calcium homeostasis through bone and kidney effects, not inflammatory processes. Inflammation creates a dramatic scene at injury sites through increased vascular permeability, and complement proteins are key players in this process. When tissue is damaged, the complement cascade activates, creating a series of protein fragments that act like molecular keys, unlocking blood vessel walls. C3a and C5a, called anaphylatoxins, cause mast cells to release histamine. This histamine makes blood vessel walls leaky, like turning a watertight pipe into a soaker hose. The endothelial cells that line blood vessels literally pull apart, creating gaps. Fluid, proteins, and white blood cells pour through these gaps into the tissue, forming exudate. This isn't a calcium or vitamin D issue. Those regulate bones. It's not parathyroid hormone managing mineral balance. This is specifically complement proteins, orchestrating the inflammatory response, making vessels permeable so immune cells and healing factors can reach the injury. The swelling we see is actually this leaked fluid accumulating in tissues. 42. Spina bifida represents neural tube closure failure during development. Which form involves spinal cord herniation into a fluid-filled sac? A. Occulta hidden form. B. Myelomeningocele severe type. C. Meningocele mild type. D. Anencephaly brain absence. Do you know the answer? Correct answer B. Myelomeningocele severe type. Explanation. Option B is correct because myelomeningocele is the most severe form of spina bifida and involves the spinal cord tissue herniating into a sac, causing neurological damage. Option A is incorrect because spina bifida occulta is the mildest form with incomplete vertebral closure, but no visible sac or herniation of the spinal cord. Option C is incorrect because meningocele involves only the meninges in the sac without spinal cord tissue, making it less severe than myelomeningocele. Option D is incorrect because anencephaly involves absent brain tissue, not spinal cord herniation into a fluid-filled sac. Myelomeningocele represents the most devastating form of spina bifida, where the spinal cord itself herniates into a fluid-filled sac on the baby's back. During fetal development, the neural tube should close completely by week 4 of pregnancy. In myelomeningocele, this closure fails dramatically. Not only do the vertebrae remain open, but the protective meninges balloon out through the gap, and critically, spinal cord tissue gets pulled into this sac. Imagine a garden hose being pushed through a hole in a wall. That's the spinal cord protruding where it shouldn't. This exposed neural tissue is damaged by amniotic fluid during pregnancy and trauma during birth. The result is paralysis below the defect level, loss of bowel and bladder control, and often hydrocephalus. This is far more severe than spina bifida occulta, which is hidden with mild symptoms, or meningocele, where only meninges protrude. Myelomeningocele involves actual nervous tissue herniation, causing permanent neurological damage. 43. Haemophilia. Results from factor VIII deficiency causing prolonged bleeding. This coagulation disorder follows which genetic inheritance pattern? A. Autosomal recessive trait. B. Mitochondrial inheritance pattern. C. Autosomal dominant trait. D. X-linked recessive inheritance. Can you guess the answer? Correct answer, D. X-linked recessive inheritance. Explanation. Option D is correct because haemophilia. A follows X-linked recessive inheritance, where males are primarily affected and females are typically carriers of the mutation. Option A is incorrect because autosomal recessive would affect both sexes equally, unlike the male predominance in haemophilia A. Option B is incorrect because mitochondrial inheritance passes maternally to all offspring, not the X-linked pattern of haemophilia. Option C is incorrect because autosomal dominant would affect both sexes equally, with affected parents having affected children. Haemophilia. A follows the classic X-linked recessive inheritance pattern, creating a genetic Russian roulette that primarily targets males. The factor VIII gene sits on the X chromosome, and here's where biology becomes cruel to males. Males have only one X chromosome paired with a Y. If that single X carries the haemophilia mutation, they have no backup. They will have the disease. Every cell lacks proper factor VIII production, causing severe bleeding problems. Females with two X chromosomes are usually protected. Even if one X carries the mutation, the normal X compensates, making them carriers who rarely show symptoms. When a carrier mother has children, each son has a 50% chance of inheriting her mutated X and having haemophilia. Each daughter has a 50% chance of being a carrier. Affected males rarely pass the condition to sons because sons get the Y chromosome from dad, not the X. This X-linked pattern explains why haemophilia appears to skip generations and predominantly affects males. 44. Carpal tunnel syndrome involves median nerve compression, causing numbness and tingling. Which demographic group most commonly develops this condition? A. Young athletic males. B. Elderly and active population. C. Middle-aged women workers. D. Adolescent student population. Do you know the answer? Correct answer, C. Middle-aged women workers. Explanation: Option C is correct because carpal tunnel syndrome most commonly affects middle-aged women, particularly those performing repetitive hand movements in work activities. Option A is incorrect because young athletic males have a lower carpal tunnel incidence compared to middle-aged women workers. Option B is incorrect because while the elderly may develop it, middle-aged working women have a higher incidence due to repetitive activities. Option D is incorrect because adolescents rarely develop carpal tunnel syndrome compared to middle-aged working adult populations. Carpal tunnel syndrome has a clear demographic favourite: middle-aged women, particularly those performing repetitive hand movements at work. The median nerve runs through a narrow tunnel in your wrist, formed by bones and ligaments. In middle-aged women, several factors converge to compress this nerve. Hormonal changes during perimenopause can cause tissue swelling and fluid retention. Years of repetitive motions, typing, assembly work or crafts, inflame the tendons sharing this tight space. The tunnel literally becomes too crowded, squeezing the median nerve like a garden hose kinked under pressure. Women's naturally smaller carpal tunnels provide less room for error. Add occupational, repetitive stress, and you have the perfect storm. This creates the characteristic numbness, tingling, and pain in the thumb and first three fingers. Young athletic males have different injury patterns. Elderly populations may have arthritis, but less occupational exposure. Adolescents rarely develop this condition. Middle-aged working women bear the brunt of this painful condition. 45. Interferons represent important antiviral defense molecules. During viral infections, which immune system produces these protective proteins? A. Adaptive B cells. B. Innate immune response. C. Red blood cells. D. Platelet aggregation system. Can you guess the answer? Correct answer, B. Innate immune response. Explanation: Option B is correct because interferons are produced by the innate immune system as an immediate antiviral defense, preventing viral spread between cells. Option A is incorrect because B cells produce antibodies as part of adaptive immunity, not the interferon proteins described. Option C is incorrect because red blood cells transport oxygen and do not produce immune proteins like interferons. Option D is incorrect because platelets function in blood clotting, not in producing antiviral interferon proteins. Interferons are your body's viral alarm system, produced by the innate immune response within hours of viral invasion. When a virus infects a cell, that cell doesn't go down without a fight. It produces interferons, protein messengers that literally interfere with viral replication. These proteins race to neighbouring cells, warning them of the viral threat. Think of it as a cellular Paul Revere shouting, "The viruses are coming." Interferon-primed cells activate antiviral programs, making themselves hostile to viral replication. They increase MHC expression to better display viral fragments to immune cells. They activate enzymes that degrade viral RNA. This happens immediately, buying time for the adaptive immune system to develop specific antibodies. This isn't B cells making antibodies. That's adaptive immunity and takes days. Red blood cells transport oxygen, not immune signals. Platelets handle clotting, not antiviral defense. Interferons are purely innate immunity's rapid antiviral response. 46. Elderly individuals show increased infection susceptibility despite having many memory cells. What characteristic explains this apparent paradox? A. excessive naive T cells, B, complete memory loss, C, decreased naive T cells, D, increased antibody production. Can you guess the answer? Correct answer, C, decreased naive T cells. Explanation. Option C is correct because elderly individuals have accumulated memory cells but have a decreased number of naive T cells, which limits their ability to respond to new pathogens they haven't encountered before. Option A is incorrect because elderly individuals have fewer, not an excessive amount of, naive T cells available to respond to new pathogens. Option B is incorrect because elderly individuals retain memory cells from previous exposures. They do not have complete memory loss. Option D is incorrect because increased antibody production would improve, not worsen, infection susceptibility in elderly individuals. The elderly immune system presents a paradox, rich in experience but poor in flexibility. Over decades, elderly individuals accumulate vast libraries of memory cells from countless pathogen encounters. They can mount powerful responses against familiar threats. But here's the problem. Their production of naive T cells dramatically decreases. The thymus, where T cells mature, shrinks with age. By 70, it's mostly fat. Without new naive T cells, the elderly can't effectively respond to novel pathogens. Think of it like a library that stopped buying new books in 1990. Great for old topics, useless for anything new. COVID-19 illustrated this perfectly. Elderly people's memory cells couldn't recognize this novel virus, and they lacked sufficient naive T cells to mount effective primary responses. They don't have excessive naive cells or complete memory loss. They don't have increased antibody production. They have an imbalanced immune system, too specialized in the past, unable to adapt to the present. 47. Translocation Down syndrome occurs when chromosome 21 material attaches to another chromosome. Which chromosomes commonly receive this translocation? A, 14 or 22, B, 1 or 2, C, X or Y, D, 5 or 6. Do you know the answer? Correct answer, A, 14 or 22. Explanation. Option A is correct because translocation Down syndrome typically involves chromosome 21 material attaching to chromosome 14 or 22 during cell division. Option B is incorrect because chromosomes 1 and 2 are not commonly involved in Down syndrome translocations. Option C is incorrect because the sex chromosomes X and Y are not typical translocation sites for chromosome 21 material. Option D is incorrect because chromosomes 5 and 6 are not common recipients of chromosome 21 translocation. Translocation Down syndrome occurs when chromosome 21 doesn't stay where it belongs, instead attaching to chromosome 14 or 22. This happens in about 4% of Down syndrome cases, creating a unique genetic situation. During cell division in a parent, chromosome 21 breaks off and fuses with another chromosome, usually 14 or 22. Think of it like a page torn from one book and glued into another. The person carrying this translocation may be perfectly normal because they have the right amount of genetic material, just rearranged. But when they have children, problems arise. Their eggs or sperm might contain the translocated chromosome, plus a free chromosome 21, resulting in 3 copies of chromosome 21 material in the child. Chromosomes 1 and 2 aren't involved in these translocations. Sex chromosomes X and Y stay separate. Chromosomes 5 and 6 rarely participate. It's specifically 14 and 22 that commonly receive chromosome 21 material, creating this alternative path to Down syndrome. 48. Arnold-Chiari malformation involves cerebellar and brainstem herniation through the foramen magnum. Which maternal factor increases risk? A. Advanced paternal age. B. Folate deficiency intake. C. Excessive calcium intake. D. High protein diet. Can you guess the answer? Correct answer, B. Folate deficiency intake. Explanation. Option B is correct because folate deficiency during pregnancy increases the risk for Arnold-Chiari malformation and other neural tube defects. Option A is incorrect because advanced paternal age is not a maternal factor. Option C is incorrect because excessive calcium intake is not associated with increased risk of Arnold-Chiari malformation. Option D is incorrect because a high-protein diet is not associated with increased risk of Arnold-Chiari malformation. Arnold-Chiari malformation risk skyrockets with maternal folate deficiency, revealing folate's critical role in neural tube development. Folate, also known as vitamin B9, is essential for DNA synthesis and cell division during the crucial first weeks of pregnancy. Without adequate folate, the neural tube, which becomes the brain and spinal cord, can't close properly. In Arnold-Chiari malformation, this results in the cerebellum and brainstem being pulled downward through the foramen magnum, the hole at the skull's base. It's like the brain structures are sinking into the spinal canal where they don't belong. Folate deficiency disrupts the precise cellular choreography needed for proper neural tube closure. This isn't about paternal age, the question asks for maternal factors. Excessive calcium doesn't cause neural defects. It's actually beneficial for bone development. High-protein diets support fetal growth, but folate deficiency directly sabotages neural tube formation, making supplementation crucial before and during early pregnancy. 49. Sickle cell anemia causes abnormal hemoglobin, leading to distorted red blood cells. Individuals with this condition retain which normal hemoglobin type? A. Adult hemoglobin only. B. No normal hemoglobin. C. Fetal hemoglobin form. D. Embryonic hemoglobin type. Do you know the answer? Correct answer, C. Fetal hemoglobin form. Explanation. Option C is correct because sickle cell anemia patients retain normal fetal hemoglobin genes, which can partially compensate for abnormal adult hemoglobin production. Option A is incorrect because adult hemoglobin is abnormal in sickle cell anemia, causing the characteristic sickling of cells. Option B is incorrect because patients do retain normal fetal hemoglobin, providing some functional oxygen transport capacity. Option D is incorrect because embryonic hemoglobin is produced only during early development, not retained in sickle cell patients. Sickle cell anemia patients harbour a genetic secret weapon. They retain normal fetal hemoglobin production capabilities. While their adult hemoglobin is defective due to the sickle mutation, causing red blood cells to form painful crescents, their fetal hemoglobin genes remain intact and functional. Fetal hemoglobin, which we all produce before birth, doesn't sickle like the mutated adult form. Some sickle cell patients naturally produce more fetal hemoglobin than others, and these individuals have milder disease. This discovery led to treatments that reactivate fetal hemoglobin production. Hydroxyurea, a common sickle cell medication, works partly by increasing fetal hemoglobin levels. It's not that they have only adult hemoglobin, that's the problem. They definitely have some normal hemoglobin in the form of fetal type. Embryonic hemoglobin exists only in early development, not in born individuals. This retention of normal fetal hemoglobin genes offers both natural protection for some patients and a therapeutic target for treatment. 50. Degenerative disc disease affects spinal shock absorbing discs between vertebrae. Which change in disc structure contributes most to this condition? A. Loss of disc fluid. B. Increased disc thickness. C. Enhanced disc elasticity. D. Improved disc nutrition. Can you guess the answer? Correct answer, A. Loss of disc fluid. Explanation. Option A is correct because degenerative disc disease is primarily characterized by the desiccation and loss of fluid within the intervertebral discs, reducing their ability to cushion the vertebrae. Option B is incorrect because degenerative disc disease typically leads to a decrease in disc height as the disc loses its structural integrity and ability to support the vertebral column. Option C is incorrect because as the disc degenerates, it loses its elasticity and becomes stiffer, making it less able to absorb shock and distribute forces evenly. Option D is incorrect because the process of disc degeneration involves a reduction in the supply of nutrients to the disc, impairing its ability to repair and maintain itself. Degenerative disc disease tells the story of spinal cushions losing their shock-absorbing power through fluid loss. Intervertebral discs are like jelly donuts, a tough outer ring called the annulus fibrosus surrounding a gel-like centre called the nucleus pulposus. This gel centre is mostly water, giving discs their cushioning ability. With age and wear, discs gradually lose this fluid, like a grape slowly becoming a raisin. As water content decreases, discs lose height, bringing vertebrae closer together. This narrowing compresses nerve roots exiting the spine. The disc becomes less flexible, more prone to tears and bulges. Without proper cushioning, vertebrae experience increased stress, leading to bone spurs and arthritis. This isn't disc thickening, they actually thin. It's not enhanced elasticity, they become stiffer. It's not improved nutrition. Aging discs have poor blood supply. The fundamental problem is fluid loss, transforming plump, resilient cushions into thin, rigid spaces that fail to protect the spine. You have reached the end of our first question set. For the free, complete exam preparation, visit our website link in the description, where you find thousands more practice questions and comprehensive study guides. Thanks for studying with us today. See you in the next video.